A groundbreaking new therapy could one day change organ transplants. For decades, scientists have been searching for a way to help the body accept the new organ without needing drugs that weaken the immune system.
And now there's a new trial providing hope for millions of patients. NBC's Dr. Ukshay Segal has the story.
At just 30 years old, Alex Hernandez has already faced a lifetime of health issues. Fighting kidney problems since he was a baby, his childhood riddled with trips to the hospital.
Yeah, looking back at it was tough. Like, you know, I would sometimes cry because I'm like, why do I got to deal with all this that's going on with my health? You know, all these other people are fine.
In college, things took a turn for the worse. His kidneys failing, forcing him to go on dialysis.
Did you think I may never get off of this?
At one time I did.
His only hope was a kidney transplant. But that meant he'd have to spend the rest of his life taking immunosuppressants every day to stop his body from rejecting the organ. These drugs, which can be up to 30 pills a day, can have nasty side effects, including stomach problems, increased risk of infection and cancer, and can even damage the new organ itself.
So one of the major drugs that's purpose is to prevent the body from rejecting a kidney can actually harm the kidney itself.
Exactly.
Dr. Sanjeev Akina, medical director of the kidney transplant program at Loyola Medicine in suburban Chicago, is one of a handful of doctors around the world trying to solve that problem by developing therapies to help with organ tolerance.
So I think when we say tolerance, we're basically saying is, can the body accept someone else's kidney without rejecting the kidney? I think the idea that you can actually be off of anti-rejection drugs for the rest of that life, I think there's a lot of benefit for that.
Now, they may have found a way, using stem cells taken from the donor.
So the stem cells, what they do is they basically reprogram your immune system. They basically tell your immune system to recognize that this donor kidney coming in is actually going to be part of your own.
The cells get implanted 11 days after the new kidney, helping the patient's immune system become a hybrid of both the donor and the recipient, preventing it from attacking the new kidney, and allowing the patient to stop taking all of those immunosuppressive drugs. A new phase 3 trial presented today at the American Transplant Congress found that after 2 years, almost 85% of patients were off all the anti-rejection meds. Doctors are hopeful this could one day apply to other types of transplants.
How do you feel?
Alex underwent his transplant 3 years ago. He's no longer on any immunosuppressive drugs. Now a dental student, Alex says he has a second chance to live a full life.
I'm able to work out. I'm able to, play sports. I'm just grateful that I can do all those things now.